Hello everyone, today I'm going to talk about healthcare sector and one disease that poses at risk to healthcare worker. Healthcare sector is basically all the organization, profession and service working to keep us healthy. This is include hospital, clinic, public health agency and community service. It's not just doctor and nurse, and many play a role too. They all rely on technology, medicine and policies to make sure care is safe and effective. Now let's talk about a disease that healthcare worker need to watch out for. Tuberculosis or TB. It's a contagious disease caused by bacteria called Mycobacterium tuberculosis. It mostly affects a lung, but it can spread to other part of body like bone and brain. Why healthcare worker at risk? Healthcare workers are most likely to catch TB because they are often around patients who have it. The bacteria spread through the air when someone cough, sneeze and talk. This increase in crowded or poorly ventilation space and when protective equipment is not used continuously.
Okay, so guys, just now we watched the video explaining about TB. So now, I will continue by showing this graph, which summarizes the TB incidence by region from 2000 to 2021. Based on this graph, we can see that overall TB cases are actually going down worldwide. From the early 2000s until around 2019, most regions shows a clear decreasing trend. But when we reach 2020 to 2021, the trend kind of slowed down and some regions even show a slight increase, which is most likely because of COVID-19, where many health services were disrupted. If we look at Central, South Asia, and also Sub-Saharan Africa, these regions have the highest TB cases throughout the years, although the numbers are slowly decreasing. East and Southeast Asia shows a very obvious drop, especially in the early years, and by the mid-2010s, it's already close to the global average. Meanwhile, Latin America and the Caribbean show slower improvement and thus even a small rebound after 2016. North Africa and West Asia stay at low moderate but also continue to decrease steadily, while Europe and North America record the lowest TB cases overall and the trend remains very stable. And lastly, Oceania stays below the global average but show a slightly increase in recent years.
Now let's look at the second graph. This graph shows the high risk of group for tuberculosis around the world. This is actually figure 8, and if you look at the original figure, you might find it a little bit confusing, but don't worry. We have converted it into a bar chart to make it easier to understand. So on the axis Y, we have the different population groups, and on axis X, we have the different number of countries where each group is the most at risk. So from this graph, we can see that adult males are the group that most affected in many countries. This could be because of higher exposure and also often social behavior. Okay, so next, the elderly are also at higher risk, mainly due to the weaker immune system as people age. And populations in areas with low literacy are more vulnerable because limited knowledge about TB can lead to delays in diagnosis and treatment. Okay, we move to the next graph that show the main risk factor for tuberculosis globally. So on the axis Y, we have the number of countries where each factor contributes most to TB. And on the axis X, we have the different risk factors. And here are 8 risk factors for TB. The first one is literacy rate and prevalence of diabetes, population of ages 65 and above, PM 2.5 air pollution, prevalence of undernourishment, poverty, head count ratio, population, male, and the last one is GDP per capita. So from this graph, we can see that low literacy is the top risk factor in many countries. This is because limited knowledge about TB can delay diagnosis and treatment. Diabetes is another major factor as it weakens our immune system and makes people more vulnerable. So age 65 and above also increases risk since the elderly have weaker immunity, and other contributing factors including undernourishment and air pollution. Understanding these risk factors is important for public health. It helps us to know why certain people are more vulnerable and allows programs to focus on prevention, education, and health intervention where they are needed the most.
Okay, now let's talk about prevention, control, and treatment for TB. First is prevention. Imagine this. A TB patient walks into a busy hospital. How do we stay safe? Masks are really matter. Regular ones are like fishing nets, but N95 masks are like superhero sheet that block all germs. Next is washing hands and having trained healthcare workers add extra protection. Kids get the BCG vaccine to prevent the TB. but adults still need a better option. Next is control. If TB detected, we act fast. The patient is isolated, ventilation is improved, like opening all the windows on a hot day, and healthcare workers wear N95 masks to stop its spreading. Finally, treatment. The sooner it starts, the better. Personalized treatment today even works for drug-resistant TB and help patients recover more faster.
So guys, later on, you know about how to prevent, control, and treat TB disease. You all might probably wondering, so how can we make things better for the health workers, right? Now I'm gonna share some ideas about that. So, first thing first, in the healthcare workplace, we need to quickly notice patients who have a cough or TB symptoms. Make sure to keep sick patients apart from others and check on them often. Why? It's simple. It helps stop TB from spreading while people wait for the treatment. Easy step and a big impact, right? Next, let's talk about the place we work in. TB spreads through the air, right? So, make sure the room have a fresh air like open windows and doors or use the outdoor waiting area. Arrange the room so air can move around. A good airflow and less germs can save everyone. So guys, we're almost at the end of the video. So, what the conclusion that we can make? What we can conclude is that TB is a still serious health problem. It spreads to the air, especially in the crowded place. Early detection, a good ventilation, and wearing masks help prevent TB. Early treatment can protect healthcare workers and the community.
TB is dangerous.
Early health checkup can save our life. Nerve yourself and your family.
Don't wait until it's too late.
Act early before silence turns into regret.